Welcome to The Explainer. Today, we're diving into a really cool therapy that takes an ancient healing practice and gives it a 21st century upgrade. So let's just jump right in. What if you could tap into all the benefits of acupuncture? You know, a therapy that's been around for thousands of years, but skip the one part that makes a lot of people nervous. Yeah, the needles. That's exactly what we're looking at today, this fusion of ancient wisdom and modern life. So at its heart, the difference is pretty simple. Traditional acupuncture, right? It uses these super thin needles to stimulate specific points on your body. And sometimes you can feel this weird, dull ache they call D-key. But with laser acupuncture, all of that's gone. The needles are replaced with a low-intensity laser beam, so there's no poking, no pricking, just a targeted beam of light. And for you, the patient, that means it's completely painless.
Okay, so how on earth can a beam of light do the same job as a physical needle? Well, to really get it, you kind of have to understand two different stories of healing that are happening at the same time. One is ancient and traditional, and the other is brand new and all about modern science.
So the first story comes from traditional Chinese medicine, and it's all about this concept called qi, pronounced chi. The idea is that this is our vital life energy, and it flows through our bodies along these pathways, almost like rivers, called meridians. When you get sick, TCM says it's because there's a blockage or a disruption in that flow. The goal of acupuncture, both the needle kind and the laser kind, is to stimulate certain points to get that energy flowing smoothly again. But wait, that's only half of it, because here's where it gets really interesting. Modern science now has a pretty compelling explanation for what's happening at a cellular level when light hits those exact same points. It doesn't cancel out the traditional view. It just adds this whole other fascinating scientific layer to it.
And this brings us to the science. It's got a big name, photobiomodulation. You might also hear it called low-level laser therapy. But really, it's just the biological process that kicks into gear when our cells get hit with this focused, low-energy light. Think of it like giving your cells a jumpstart. A low-intensity laser is pointed at the skin, right? But its target is way deeper. That light energy gets soaked up by our mitochondria. You remember them from biology class. They're the powerhouses of our cells. Well, this light tells them to ramp up production of something called ATP, which is literally the fuel that powers our cells. This energy boost then kicks off a chain reaction, releasing other helpful molecules that can improve blood flow and knock down pain and inflammation. And this isn't just an idea. It's backed by some serious science. This quote from a biomedical engineering journal kind of says it all. A photon of light gets absorbed, an electron gets excited, and boom, you have stored energy that the cell can use to heal itself. It's literally turning light into biological energy. So, we have the traditional view and the scientific one. But what does this actually mean for you in the real world? Well, the applications are, honestly, they're surprisingly broad. The number of things laser acupuncture has been studied for shows just how powerful it can be. I mean, just look at this list. It covers so much ground. You have things you might expect, like muscle and joint pain, and even metabolic issues. But then it gets into these really specialized areas, like improving vision for people who are nearsighted, or even offering new support for kids with autism spectrum disorder. It's a huge range. A list is one thing, but the case studies, that's where you really see the impact this therapy can have. Let's look at a couple of powerful examples from the medical literature. Okay, first up, pain. There's this case study of a 35-year-old guy who had a really bad shoulder dislocation. His pain was an 8 out of 10. I mean, that's a serious, life-altering level of pain. But after 12 laser acupuncture sessions, it dropped all the way down to a 2. He got his full range of motion back and could even play sports again. That's a massive change. And the results for vision are just as amazing. Check this out. A 7-year-old girl with nearsightedness. She had visual acuity of about 0.3 and 0.4. After 24 sessions, her vision jumped to 0.8 in both eyes. Her vision more than doubled. That is a huge deal for a little kid. But maybe one of the most remarkable areas is in neurodevelopment. There was a proper, randomized controlled trial with kids on the autism spectrum. And what it found was that the real laser acupuncture, it led to significant improvements in their speech and social skills compared to a placebo or sham treatment. And when I say significant, I mean just look at this number. For speech expression, the kids who got the real laser treatment were over 50 times more likely to improve than the kids in the placebo group. 50. A number that big tells you something profound, something real is happening at a biological level.
So all of this brings us to a really practical question. Why would a doctor or a patient actually choose this? Well, on top of being effective, laser acupuncture has some really clear advantages. The most obvious one, it's totally painless. That's a game changer for anyone with a fear of needles. And because it's non-invasive, there's no breaking the skin, which means no risk of infection. This makes it perfect for treating sensitive spots, like near a wound or a scar. And it's a huge reason why it works so well for kids or patients who have a tough time staying still.
And what about safety? This is one of the biggest selling points. Across all the research that's been done, the safety profile is just fantastic. When it's done by a trained professional, there are simply no documented side effects or complications. It's incredibly safe.
So in the end, laser acupuncture is this powerful marriage of ancient maps of the body and modern cell biology. It's using the physics of light to activate healing pathways that we've known about for centuries. It really opens up this fascinating new frontier in medicine. And it leaves us with a pretty cool question. As our technology for controlling light gets more and more precise, what other parts of human health will we be able to illuminate next?